1. Ozempic and Wegovy linked to pancreatitis, UK reports 400 cases. 2. Potential deadly side effects of Ozempic and GLP-1 drugs, what you need to know. 3. Deadly risk of Ozempic and weight loss drugs, new investigation reveals pancreatitis danger. 4. Warning, fatal side effects linked to semaglutide, Ozempic, Wegovy, diabetes drugs. 1. Ozempic and Wegovy linked to pancreatitis, UK reports 400 cases. In recent discussions surrounding popular weight loss medications, a striking concern has emerged: the potential link between drugs like Ozempic and Wegovy and a serious condition known as acute pancreatitis. With nearly 400 cases reported in the UK alone, including some fatalities, experts are sounding the alarm for increased vigilance and monitoring of symptoms associated with these medications. GLP-1 receptor agonists, such as Ozempic, Wegovy, and Mounjaro, have gained significant traction for their effectiveness in aiding weight loss and managing type 2 diabetes. While these drugs have been celebrated for their transformative benefits, a growing body of evidence is prompting experts to highlight some rare yet severe side effects that warrant attention. In the UK, health authorities have documented close to 400 instances of serious pancreatic complications, particularly acute pancreatitis, among individuals using GLP-1 medications. The Medicines and Healthcare Products Regulatory Agency, MHRA, which oversees drug safety through its Yellow Card reporting system, is now advocating for caution and further investigation into these alarming findings. So, what exactly is acute pancreatitis? This condition refers to a sudden inflammation of the pancreas, a vital gland located behind the stomach that plays a crucial role in digestion and regulating blood sugar levels. Symptoms can be quite severe, including intense abdominal pain, nausea, and fever, often necessitating hospitalization for treatment. While many patients do recover with appropriate medical care, acute pancreatitis can escalate into serious complications or even lead to death. Alarmingly, UK health officials have linked at least 10 fatalities to this condition among users of GLP-1 drugs like Ozempic and Mounjaro. Drug information leaflets typically indicate that pancreatitis is a rare occurrence, affecting approximately 1 in 100 users. However, the recent surge in reported cases has prompted a renewed focus on the importance of monitoring and recognizing early warning signs. A spokesperson from the MHRA noted, "Sometimes genes can influence the side effects an individual experiences when taking a medicine, suggesting that future genetic screening could help identify individuals who may be at a higher risk for these adverse effects." What do the manufacturers of these drugs have to say about the situation? Pharmaceutical companies producing GLP-1 medications are taking these concerns seriously. Lilly, the maker of Mounjaro, stated, "Patient safety is our top priority." Meanwhile, Novo Nordisk, the producer of Ozempic and Wegovy, emphasized the importance of using these medications under the guidance of a healthcare professional. Both companies are actively monitoring safety data and collaborating with regulatory bodies to minimize risks associated with their products. Is this issue confined to the UK? Not at all. While US regulators, including the FDA, have yet to initiate a formal investigation, they do mandate warning labels on all GLP-1 drugs regarding the risk of acute pancreatitis. They are also closely monitoring reports of side effects. In the United States, a case was reported involving a 36-year-old woman who developed pancreatitis just 5 weeks after beginning treatment with semaglutide, the active ingredient in Ozempic. A 2024 analysis revealed a staggering 6,751 global cases of acute pancreatitis linked to GLP-1 drugs from 2005 to 2023. Notably, one study indicated that patients using these medications were twice as likely to develop pancreatitis if they had taken the drug within the previous 30 days. While the advantages of GLP-1 drugs are still deemed to outweigh the risks for many individuals, experts strongly recommend that these medications be used only under medical supervision. If you are currently taking Ozempic or a similar drug and experience symptoms such as severe abdominal pain or nausea, it is crucial to seek medical attention immediately. Both healthcare providers and patients are now being encouraged to remain vigilant for warning signs and to make informed decisions regarding the use of these powerful medications. What are your thoughts on the safety of GLP-1 drugs? Do you believe the benefits justify the risks? Share your opinions in the comments below. 2. Potential deadly side effects of Ozempic and GLP-1 drugs. What you need to know. Imagine taking a weight loss drug that promises to help you shed those extra pounds, only to discover that it could have potentially deadly side effects. This is the alarming reality that has come to light with GLP-1 drugs like Ozempic, which have been touted as a miracle solution for weight loss. But here's where it gets controversial. A new investigation has revealed that these drugs may have much more serious, and even potentially deadly, side effects than originally thought. The UK's Medicines and Healthcare Products Regulatory Agency, MHRA, has received nearly 400 reports of serious pancreas trouble from users of GLP-1s, including cases of acute pancreatitis, which can be managed but can also occasionally cause fatal complications. In fact, there have been at least 10 deaths linked to this condition among GLP-1 drug users in the UK. So, what's behind these potentially deadly side effects? According to the MHRA, sometimes genes can influence the side effects and individual experiences when taking a medicine. This raises an important question: could genetic testing be the key to preventing these serious complications? The MHRA's Chief Safety Officer, Dr. Alison Cave, believes that almost a third of side effects to medicines could be prevented with the introduction of genetic testing. But this is the part most people miss. Genetic testing is not yet a standard practice in the pharmaceutical industry. And this is where things get really interesting. If genetic testing could prevent so many serious side effects, why isn't it being used more widely? Is it a matter of cost, or is there something more at play? The MHRA's findings have sparked a new investigation into the safety of GLP-1 drugs, and it's essential that we get to the bottom of this issue. After all, the stakes are high. We are talking about potentially deadly side effects that could be affecting thousands of people. So, we want to hear from you. Do you think genetic testing should be mandatory for certain medications, or do you believe that the benefits of these drugs outweigh the risks? Share your thoughts in the comments below. As we delve deeper into this issue, one thing is clear: the conversation around weight loss drugs and their potential side effects is far from over. In fact, it's only just beginning. And this is the part that will spark a lot of debate. Should we be prioritizing the development of new weight loss drugs, or should we be focusing on more holistic approaches to health and wellness? The answer, much like the solution to this problem, is complex. But one thing is certain: we need to be having this conversation, and we need to be having it now. 3. Deadly risk of Ozempic and weight loss drugs. New investigation reveals pancreatitis danger. Potentially fatal side effects of weight loss drugs spark new investigation. There's no doubt that GLP-1 drugs like Ozempic have been revolutionary, although the benefits do sometimes come with some unsightly downsides. https://nypost.com/2025/08/health/the-most-bizarre-side-effects-of-weight-loss-drugs. Such as a smooth decay. https://nypost.com/2025/05/21/health/ozempic-teeth-the-latest-alarming-side-effect-of-weight-loss-drugs, and a droopy face. https://nypost.com/2025/04/25/health/people-with-Ozempic-face-are-doing-this-to-fight-wrinkles-and-sagging, or a mouth. https://nypost.com/2025/05/03/health/ozempic-mouth-shocking-new-site-effect-of-weight-loss-drug-scene-in-some-celebs-report as a saga-bat. https://nypost.com/2024/05/1//lifestyle/ozempic-but-latest-site-effect-of-weight and hair loss. https://nypost.com/2025/036/14/health/2-waist-to-combat-hair-loss-weight-loss-drug. Then there are the more common side effects. https://nypost.com/2025/06/26/health/ozempic-without-side effects/new-drug-may-be-weight-loss-game-changer, such as icky gastrointestinal issues. https://nypost.com/2025/056/01/health/top-reasons-ozempic-users-visit-the-when-you-should-go, which are at best unpleasant. Now, a UK regulator is shining on side effects that are much more serious and potentially deadly. The country's Medicines and Healthcare Products Regulatory Agency's Yellow Card Scheme, the UK's official system for collecting and monitoring reports of suspected side effects or bad reactions to drugs and devices, has received nearly 400 reports of serious pancreas trouble from users of GLP-1s. Acute pancreatitis. https://nypost.com/2022/06/29/what-is-pancreatitis-explaining-Travis-Barker's health-scare sudden, often extremely painful inflammation of the pancreas that usually sends people to the hospital with severe abdominal pain, nausea, and fever. While in many cases it's manageable, it can occasionally turn serious or even fatal if it triggers complications. In the UK alone, there have been at least 10 deaths. https://www.telegraph.co.uk/news/2025/06/26/weight-loss-jabs-link-pancreas-problems-after-10 linked to this condition among users of GLP-1 drugs. Pamphlets on popular weight loss drugs note that pancreatitis is an uncommon reaction that only affects 1 in 100 users, but the condition is deemed serious enough to warrant further investigation. Sometimes genes can influence the side effects and individual experiences when taking a medicine, the MHRA told The Guardian. https://www.geoguardian.com/url/q=https://www.theguardian.com/society/june/weight-loss-diabetes jab users report pancreas problems and de laughing face and sauce indicating they hope genetic screening might cut future risk. Patient safety is Lilly's top priority, the pharmaceutical company that makes Mounjaro told The Guardian. https://www.theguardian.com/society/2025/june/26/weight-loss-diabetes-jab-users-report pancreas problems. We take reports regarding patient safety seriously and actively monitor, evaluate, and report safety information for all our medicines. We recommend patients take these medications only for their approved indications and under the strict supervision of a healthcare professional, who can also advise on potential side effects. We continuously collect safety data on our marketed GLP-1 medicines and work closely with authorities to ensure patient safety. The benefit-risk profile of our GLP-1 medicines remains positive, and we welcome any new research that will improve our understanding of treatments for people living with chronic diseases. Although US regulators like the FDA have not launched an investigation, they do require all GLP-1s to carry warnings about the risk of acute pancreatitis and are monitoring for this side effect. Every morning, the New York Post https://nypost.com/New York-Postcast offers a deep dive into the headlines with the Post's signature mix of politics, business, pop culture, true crime, and everything in between. Subscribe here. https://link.chtbl.com/New York-Postcast. A case study, https://pmc.ncbi.nlm.nih.gov/article/pmc11416045, describes a 36-year-old woman in the US who developed acute pancreatitis within 5 weeks of exposure to semaglutide therapy. The paper references a study involving 1,269 hospitalized cases of acute pancreatitis demonstrated that patients who were exposed to GLP-1 within the last 30 days were over twice as likely to develop pancreatitis. A 2024 analysis, https://www.frontiers.org/journal/pharmacology/article/10233896F.2024.1461398/4, also found 6,751 reports of acute pancreatitis associated with GLP-1 drugs between 2005 to 2023. 4. Warning: fatal side effects linked to semaglutide, Ozempic, Wegovy, diabetes drugs. Diabetes medication alert: the hidden dangers lurking in your prescription. Are you or a loved one taking semaglutide for diabetes management? Overseas health officials have just sounded the alarm on a potentially fatal side effect linked to this medication. But here's where it gets crucial: knowing the warning signs could be a matter of life and death. The medication in question, semaglutide. Semaglutide, a medication prescribed to manage type 2 diabetes, has been under scrutiny lately due to its serious, potentially life-threatening side effects. But what exactly is semaglutide, and how does it work? Essentially, it's a glucagon-like peptide 1, GLP-1, receptor agonist, designed to help lower blood sugar levels by enhancing insulin secretion and decreasing glucagon levels in the body. The warning: serious side effects unveiled. Overseas health officials, tasked with monitoring drug safety, have issued a stark warning about the severe side effects associated with semaglutide. These are not your run-of-the-mill, manageable side effects. They can be potentially fatal if not recognized and treated promptly. So, what are these critical signs you need to watch out for? Subscribe to unlock the full list of warning signs and ensure your safety or that of your loved ones. Link to subscription, Understanding the risks, a deeper dive. But why do these severe side effects occur? It's essential to understand that while semaglutide is effective for many, its impact on the body can sometimes lead to unforeseen, dangerous reactions. This highlights the delicate balance between managing diabetes and mitigating medication risks. And this is the part most people miss. The interplay between semaglutide and other health conditions or medications can significantly increase the risk of these fatal side effects. It's not just about the drug itself, but how it interacts with your unique health profile. Controversy alert: we want to hear from you. Should the benefits of semaglutide for diabetes management outweigh the risks of potentially fatal side effects? Or should stricter prescribing guidelines be put in place to protect patients? Share your thoughts. Do you believe the current warnings are sufficient, or should more be done to alert patients? Have you or someone you know experienced side effects from semaglutide? Share your story. Stay informed, stay safe. For the full, in-depth look at the warning signs, the latest research on semaglutide, and expert advice on navigating diabetes management safely, subscribe now and gain unlimited access to our health insights and more. Subscription details. Full digital access, $4 for the first 4 weeks, then $32 every 4 weeks. 12 months upfront, $312, then $34 monthly. No lock-in contract for flexible subscriptions. Unlimited articles, subscriber-exclusive news emails, and more.